Hello and selamat sejahtera Malaysia. This is the 14th episode of Centered Science, a community education project sponsored by Pusat Perubatan Naluri and streamed to you from Facebook Live to Astro Awani. So in the months since Tan Sri Jamila Mahmud, advisor to the Prime Minister of Malaysia on public health, and Professor Dr. Adiba Kamaruzzaman, infectious diseases specialist, premiered this non-jargon, right-to-the-point series, we've grown our viewership organically in leaps and bounds, and we would like to say a big thank you to all of you who share our links and tune in weekly. This week, our show has gotten one of the highest uptakes because of a very pressing topic, that of pregnancy and childbirth in the time of COVID.
Hello, everyone. Assalamu alaikum. It's so nice to welcome Dr. Imelda and, of course, my partners, Adiba and Karen, and Selamat Tengah Hari Malaysia. Before we start, let us spend a moment to think about those who have fallen in COVID. We've also lost a beautiful nurse who was pregnant with a 7-month-old child. So our deepest condolences to the families of those who have lost loved ones. But her passing is also a grim reminder for us on how vulnerable women who are pregnant are in this time of COVID. So we hope this session today will help to address some of the concerns and anxieties of women writ large and men who may have loved ones who are pregnant or who are planning to get pregnant or are lactating. So a very, very warm welcome to Imelda. It's the first time I'm meeting you, so really delighted to have you here.
Oh my God, I'm so starstruck. I am an absolute fan of yours, Tan Sri Jamila and Professor Adiba. I'm so star-struck today. I really don't know whether I can handle myself today. I better be calm.
Oh, yes, there's someone who has 500,000 followers on Facebook. So I think we have no better person to speak to us on this topic than these two obstetrics and gynecology specialists, Karen. So over to them and over to you.
Sure. Just a little bit of background in case anybody does not know who our special guest is. Dr. Imelda is a graduate of the University of St. Andrews, University of Manchester, as well as Imperial College London, where she gained her Master's of Public Health. So we're pleased that you made time for the show today, Imelda. Thank you so much. We're looking forward to you bringing your bold, brassy, science-led facts, the same way that you did for Medical Mythbusters Malaysia, screened on Astoria, as well as your show, Tanya, Dr. Imelda. Because of your strong following also among the Malay-speaking community, we are also asking you to please feel free to, cakap dalam bahasa Malaysia kalau ada apa-apa yang harus diperkembangkan dalam bahasa Malaysia, tolong kembangkannya, ya. So please tell us a little bit more about yourself, and you've just come from delivering a baby.
Yes, I did.
Was it a normal pregnancy?
Yeah, normal pregnancy and a normal birth, except of course in a COVID situation, when we have in a pandemic situation, advice changes for all our pregnant mothers. During their pantang time, the advice is don't allow visitors to come and see your baby, right? You don't have to pantang balik kampung, jangan merentas negeri. You got to look after yourself first. You got to look after your baby and don't be exposed to anything else. The message that I tend to give all pregnant women who give birth is you can pantang on your own. This is women power. You can do it. After all, you have just given birth, which is harder than a lot of challenges in the world, and you can pantang on your own. There is no need to have somebody looking after you. You can do it. So there are ways and advice, a lot of tips that can come to women who need them, and a lot of moral support from our part to ikut SOP.
Yeah. In fact, Dr. Imelda memang betul tu, sebab time pantang ni orang nak datang tengok ibu, tengok baby, jangan bagi siapa-siapa cium baby ya, sebab kita tengok bayi dan anak-anak pun dah dijangkiti COVID-19. Jadi tolonglah lindungi keluarga. Tak perlulah jumpa siapa-siapa, dengan keluarga rapat cukuplah.
Ya, dan kita pun nasib baik sebab zaman sekarang boleh buat video call.
Betul, betul.
And you can use very nice filters to make you look glowy and postpartumly dewy, right?
Yeah.
All right, so first of all, I need to remind our viewers that our Dr. Jamila is also an obstetrician and gynecologist, and heck of an effective one too. So we're going to benefit from two stellar opinion leaders and professionals, with Professor Adiba taking questions on the infectious disease part of the questions. So let's go. Question 1. As healthcare and reproductive specialists, both Dr. Jamila and Dr. Imelda, would you discourage couples who are trying to get pregnant during this time of COVID?
Well, I would say that is not in my place to tell couples to get pregnant or not. My advice is for each individual couple to self-assess. Is this a good time for you to get pregnant in terms of your economic situation? Usually, if the husband has lost a job or an income, you will find that it's a bit of a struggle. Many people are struggling now. So if you feel that it is an economic burden for you right now, then you should delay getting pregnant. But it's not for us to tell you what to do. And it's not a same message for everybody. You got to look into your own situation. If you have medical health issues, then you got to sort out your medical problems first. I tell all pregnant women, all women the same advice. If you have diabetes, you got to make sure it's under control before you get pregnant. If you have obesity, then you got to lose that weight so that you can have a healthy pregnancy outcome. And what is most important is that the healthy pregnancy outcome depends on your health before getting pregnant, and that's most important. So the delay in pregnancy also depends on your health, your economic situation, what you want as a couple.
Betul. Sebenarnya ialah decision untuk nak pregnant, tak pregnant is up to the couple.
Betul.
Tapi bukan sahaja dari segi ekonomi dan juga kesihatan fizikal, tapi kesihatan mental juga ya. COVID-19 ni dah setahun setengah, ada banyak tekanan kepada kita semua, terutamanya yang mereka yang dah ada anak, banyak masa ditumpukan untuk membantu anak tu belajar online dan sebagainya. Jadi untuk menjadi hamil tu ialah itu satu kurnia daripada Allah, it's a rezeki from Allah, but you kena rasa diri you sendiri prepared sebab kesihatan ibu dan kesihatan mental juga sangat penting.
Okay, so religious morality aside, would you promote the use of contraception right now? Why or why not?
My stance on this is that if you are not ready for pregnancy, then definitely you got to know about contraception, which is effective for you. If you want to get pregnant, then obviously don't use contraception. It's a very, very clear-cut answer. So kalau kita cakap dalam bahasa Malaysia, dalam 100 orang yang menggunakan kaedah merancang keluarga yang secara natural. Natural tu maknanya ramai orang buat kita panggil coitus interruptus, which is yang orang lelaki pancut di luar. Ini yang cara merancang keluarga yang ramai wanita Malaysia guna, tetapi dia punya failure rate sangat tinggi. Maknanya dalam 100 pasangan suami isteri yang menggunakan kaedah ini, 25 orang akan datang ke klinik hamil saya dalam setahun sebab mereka hamil juga. Jadi dari segi kalau anda kata you are not ready for pregnancy, therefore you got to think about using an effective contraception that works. And the most effective one is the implant, is the contraceptive subdermal implant yang tahan 3 tahun. Yang tu kalau 100 orang menggunakan implant tu, saya akan tunggu 20 tahun di klinik saya before one person fall pregnant. That's how effective the implant is compared to kaedah merancang sendiri-sendiri. So if you decide this is not a good time to get pregnant, then my advice is find the effective form of contraception.
Dr. Jim?
Yeah, Imelda has answered everything. Contraception is ada wanita yang lebih sesuai untuk satu jenis contraception daripada another one. Jadi ini adalah satu yang harus dibincang dengan doktor supaya kita boleh nasihat yang mana yang paling sesuai untuk anda.
Alright. So the third question is, my partner and I are trying to get pregnant. Both of us are recovering from COVID. I've heard the virus stays in our bodies. How long should I wait before I can safely try to conceive again?
Okay, well, that is a very good question, Karen, because that's a very common question. If you have recovered, you can conceive. That is not an issue because you are no longer infectious. If you have recovered, you have developed temporary immunity to the virus, and your antibodies that you have developed will be passed down to your fetus through the placenta. So there is no issue about worrying about conceiving once you have recovered.
All right, that's a very, very reassuring statement of fact.
Yeah,
very
and
much.
even if you said you still harbor the virus, the fact that you have recovered means you have developed immunity.
Right.
And therefore, and you know, when you have COVID, you know, even if you still have COVID illness, this virus usually is not passed to the baby through the placenta.
Okay, so would that mean that the newborn infant actually has some kind of protection against COVID?
We hope so, because we know that antibodies that mother generates, generally speaking, antibodies can pass through the placenta to the baby. All right, and we know that some antibodies also pass through breast milk to the baby. And therefore, I think we have less to worry about if you have recovered from COVID compared to someone who's never got COVID and trying to get pregnant.
All right. And question 4, if I get COVID while pregnant, will my baby get it too? Is that a surety?
That's another common question. Again, we talked about that already just now, that, you know, if you have the COVID virus, the placenta is a really good barrier. So we find that in the majority of mothers who have COVID during pregnancy, the fetus is not affected by the virus. The virus cannot cross the placenta to cause fetal congenital malformations. There is no actually data to tell us that there is more miscarriage, because there are, I believe, 100 million people have now been infected with COVID throughout the world. And we have not received any data to say that there is more miscarriage or there is congenital abnormalities as a result of this. There's no increase in the rate of congenital malformations. And so we know that this virus is less likely to affect the baby unless the mother develops severe disease in pregnancy. So if you develop severe disease, that is when you have problems with oxygenation in your body, and that will affect your baby. And to help with oxygenation, you're more likely to end up with a preterm cesarean section. So we find that in mothers who have symptomatic severe disease, the risk of cesarean section is increased threefold. And therefore, then it's when the baby is at risk of requiring premature care in intensive care unit for newborn babies who are premature. But if you had asymptomatic disease in pregnancy, that means you don't have symptoms in pregnancy, then you recover, and that usually doesn't cause any problems to your baby, and you're not likely to have more preterm birth than anyone else who didn't have COVID.
Okay, very, very succinct. Thank you. Dr. Imelda, there was this heartbreaking story going around on social media where an obstetrician wrote about the high stress and technicalities of developing a baby from a mother with COVID. You know, it was horrible, it was jarring, it was painful, it just hit home in the worst possible of ways. Have you ever been in that situation? And can you tell me what that's like?
Yes, it is very heartbreaking. Now, if you are at a very infectious stage if you're a symptomatic mother who needs care in intensive care unit, severe enough that, you know, your oxygenation levels have dropped and we needed to do a preterm cesarean section, then the baby will be taken away to intensive care unit, will be separated from you. And that is actually a very, very hard for the mother to be, because another thing is that they are not likely to get support from family who cannot come because you have to be quarantined in a hospital. So it's a double whammy, it's a double blow to the mother, because not only the baby separated from them, they are not able to see their babies, their families can't come to visit them, and they rely on our moral support to help them get better. So this is a very hard situation for mothers to be in.
That sounds really, really awful. The support network is so important for women postpartum, and it's to be completely isolated from that it just doesn't bear thinking about. It's horrible. So the next question is for you, Dr. Jamila. What is the government's stand to the administration of COVID vaccines to pregnant women? I know last week you shared you had taken on the task of ensuring there was a column in the MySejahtera vaccine application which asked if women were pregnant or breastfeeding. Can you bring us up to speed on this one, please?
Yeah, thank you very much, Karen. Sekarang kalau kita lihat MySejahtera, ada button untuk pregnancy. So you can actually click on that to update your status. Untuk wanita yang hamil, kita syorkan vaksin Pfizer diberikan antara 14 hingga 33 minggu kehamilan. Inilah ideal time, ya. Jadi kalau anda hamil, tolong jangan miss your opportunity to get your vaccine during pregnancy. Pfizer adalah banyak digunakan sebab ia adalah vaksin yang pertama dikeluarkan di dunia. Jadi pada masa tu di Amerika Syarikat terutamanya ramai orang yang hamil yang merupakan frontliners juga. Jadi mereka juga terima vaksin Pfizer dan followed through, ya, pregnancy dan selepas kehamilan, dan didapati tidak ada kesan yang buruk atau kesan sampingan kepada mereka atau kehamilan mereka sendiri. So please, for the women who are pregnant, please get your vaccines timed from 14 to 33 weeks. Dan kalau anda ada soalan, saya lihat di Facebook, di mana kalau anda pernah dapat first shot dan sebab your gestation 14 hingga 33, kalau tak sempat ambil second shot lepas first shot tu dan dah lepas 33 minggu, you can discuss. Bukannya kata you cannot get the second shot at 34 weeks or things like that. It's not like, cast in stone. So it's a case by case. Mungkin kalau, you've never had premature labor dan sebagainya, it shouldn't be a problem. Dan kita boleh time your vaccine accordingly. Tapi mereka yang sudah lahir, kan anak, sila ambil vaksin itu.
All right, Dr. Jim, what is what's the magic number? You said 14 to 33 weeks. Why is it only available in this particular period?
Yeah, 14 weeks marks the second trimester of pregnancy, where usually the second trimester is the calm trimester for most pregnant women, right? You don't get those morning sickness and you've got over that. If you are going to have a miscarriage due to congenital reasons, normally it is in the first trimester. So just not to complicate things. And 33 weeks because viability of the fetus 32 weeks onwards is very viable. So in case of premature labor, we don't want to complicate things for pregnant women. So that's the only reason. But this is why it's not cast in stone. So if, for example, you had your first dose at 30 weeks and for some reason you didn't take the Pfizer second shot at 33 weeks and you went on to 34, it doesn't mean you can't get it. We have to look at you on a case-to-case basis.
Yeah, I agree with that case-to-case basis, because I've certainly given the vaccine to a pregnant woman beyond 33 weeks because she's a frontliner, and frontliners have higher risk of exposure. We got to look at your pros and cons. If you are at risk of exposure and you belong to the vulnerable group, for example, you are pregnant and you have diabetes and you have a lot of medical problems during pregnancy, you are more at risk of a more severe COVID illness because of your risk factors. So actually, it's not cast out in stone. Discuss with your obstetricians because if you're a higher risk group, there's a provision for you to have it, especially the frontliners.
Awesome, thank you. Prof. Adiba, you said, can you please read this one?
Yeah, I just wanted to stress the importance of getting our pregnant ladies vaccinated. Imelda, I know you've highlighted the fact that those who have diabetes, mereka yang ada kencing manis, darah tinggi dan berat badan yang berlebihan, seperti juga wanita yang tidak hamil have a high risk of getting severe category 3, 4 and 5 disease. Tetapi pregnancy itself puts women at higher risk of getting severe disease. So I think, Tan Sri, we cannot underestimate the importance of getting pregnant and vaccinated. Yeah.
Yes.
Sebab kehamilan is a state of immune deficiency. Ya.
Yes.
Jadi sistem immunity kita semasa hamil tu memang rendah berbanding dengan wanita yang tidak hamil, dan sebab itulah sangat penting untuk mereka menerima vaksinasi, terutama mereka yang berisiko tinggi. Kalau terdedah pada kes COVID, terutamanya frontliner, dan frontliner bukan saja frontliner kesihatan, juga ada frontliner lain yang bekerja berhadapan dengan masyarakat, seperti mereka yang kerja counter, misalnya jualan makanan ataupun counter bank dan sebagainya. Mereka juga terdedah pada orang ramai. Jadi kita perlu mengambil tindakan untuk mereka juga menerima vaksin.
Betul.
Somebody commented that I'm speaking Malay today. I think
that's really lovely. Dan saya nak
I don't speak Malay.
Maybe it's that my effect. Dan saya nak tekankan kepada semua wanita yang hamil, jangan takut ambil vaksin. Sebab bila anda ambil vaksin tu, bukan hanya anda melindungi diri sendiri, kita tahu antibody yang anda buat daripada vaksin itu juga melindungi anak dalam kandungan dan juga dijumpai dalam susu ibu lepas bersalin, boleh melindungi ibu yang menyusukan bayi kemudiannya. Jadi kita also tahu bahawa wanita mengandung kalau dapat COVID ada risiko lebih tinggi dimasukkan ke dalam intensive care unit adalah daripada wanita yang tak mengandung. Jadi sangat penting untuk ibu-ibu yang mengandung ni mendapat perlindungan. Kita mesti protect our mothers, protect our babies.
Absolutely.
Malangnya sebelum ni there was a lot of confusion mengenai vaksin dan the side effects dan safety kepada wanita-wanita yang mengandung. This was because masa the clinical trials, the big clinical trials were done, pregnant women and those who were breastfeeding were excluded from the clinical trials as participants. This is very, very normal for clinical trials. But as Tan Sri said tadi, after millions and millions of doses have been given to women in US, UK, Israel, and Dr. Imelda, you also pointed out that we've not seen any adverse reaction. It is now pretty much conclusive that vaccination is safe in pregnancy and breastfeeding mothers.
Absolutely.
Karen, ada soalan di dalam, they prefer me to speak in BM, so I will. Ada soalan di dalam Facebook yang bertanya, adakah wanita yang hamil diberi keutamaan? Memandangkan sekarang fasa 2 kita memberi pada orang yang 60 ke atas. Sebenarnya untuk kehamilan is a very special group sebab yang hamil tu taklah seramai 32 juta rakyat kita, tetapi window tu, maknanya jangka masa untuk kita memberi vaksin tu hanya 14 hingga 33 minggu. Jadi yang mana yang hamil tolong cepat-cepat beritahu pada MySejahtera app tu boleh klik dan beritahu ataupun email kepada website kita dan kita akan cuba timekan vaksin tu supaya dalam jangka masa 14 hingga 33. Jadi ada juga soalan kenapa kita pilih Pfizer berbanding dengan AstraZeneca. Ada beberapa sebab. Nombor satu yang paling utama ialah kita punya vaksin profile, ada 70% vaksin profile kita adalah Pfizer. So we have a lot of Pfizer vaccines, and Pfizer has been well studied in pregnancy. So it's a safe vaccine. AstraZeneca is only at 10% of our vaccine profile. Jadi kita kena make sure ada 2 dos untuk sesiapa yang hamil. Jadi yang paling baik ialah Pfizer. Pfizer. Dalam Royal College of Obstetrician and Gynecologists, I think Imelda, you and I come from the RCOG, dan juga Canadian ONG Society dan juga Australian, mereka gunakan juga AstraZeneca. Tapi di Malaysia, oleh kerana vaksin profil kita sangat lebih pada Pfizer dan ia memang selamat, kita akan utamakan wanita yang hamil untuk mengambil Pfizer.
Alright. As a matter of interest, Dr. Imelda, have you seen fewer pregnancies in the past year, or have the numbers of pregnancy increased because of lockdown and working from home?
I cannot say the numbers of pregnancies overall have increased. I have seen more, but it does not mean to say, I'm very biased, I'm only one person. It does not mean to say the numbers of births have increased overall. You're going to need to get the data from national statistics for birth counts. But where I am concerned, I am seeing a rise in numbers who attend the private sector. Sebab sekarang ni kan musim COVID ni, sebab kita perlukan penjarakan sosial, maka suami-suami tidak dibenarkan datang ke klinik bersama isteri di government sector sebab crowding kan, terlalu ramai orang. Dan untuk melindungi semua orang, maka isteri tidak boleh ditemani oleh suami di dalam bilik bersalin, dan suami akan dapat appointment untuk masuk berjumpa dengan baby sekejap saja semasa di hospital. Ini sangat penting untuk melindungi semua orang daripada jangkitan COVID-19. Jadi ramai juga yang berasa yang mereka perlukan suami bersama mereka untuk teman akan pilih private sector, sebab di private sector kita boleh buat penjarakan sosial, kita tak ramai orang. Jadi bila suami dan isteri sudi nak buat COVID test, jadi bila dia orang negatif, mereka boleh masuk, dibenarkan masuk untuk menemani isterinya di bilik bersalin. So I feel that this is one of the reasons why I'm seeing a rise in numbers of birth under my care. So I'm getting very, very busy because of that. There are a lot of stress among mothers who are pregnant in the time of COVID. Memang ada lebih lagi kegelisahan, anxiety, dan sedikit depression, mental health disorders we call it, is increased and heightened during the time of COVID, and they need a lot more support.
Yeah, it would seem either way, you know. It is a very strange time to be bringing new life into the world, and it seems to very many as a very dangerous time as well. A question from our Facebook viewer: I've just taken my first dose of vaccine. I'm going to take my second dose of Pfizer. Is it safe if I get pregnant in between the second doses? Will it affect the baby's development in any way?
I think this is similar question to before. The answer is the same. So if you are planning for a pregnancy, we are not worried if you take the vaccine, and if you are pregnant and you happen to be in the first trimester and you just found out you're pregnant when you've had the vaccine, we know that generally speaking, it is not harmful for the pregnancy, and we won't worry about things like that. You know, it just happened to. You know, we cannot always control everything. So if you happen to get pregnant in between the 2 doses, then my advice is, well, don't worry about it. Just continue with your pregnancy and don't worry about it. The vaccine does not contain any virus. All right, the vaccine is safe for pregnancy.
All right. So yes, Dr. Jim, you were saying.
Karen, ada juga soalan yang menyatakan dia dah terima first dose vaccine, didn't know she was pregnant. got the second dose in the second trimester, should she take a third dose? No. At the moment you get your 2 doses, that's enough. Alhamdulillah, you're protected for now. Of course, ongoing research masih lagi ada. Adakah kemungkinan kita perlu mengambil satu booster shot? Itu kita belum tahu lagi. Dan kalau kita tengok keadaan COVID ni akan menurun dan kajian-kajian menunjukkan tak perlu ambil booster shot, kita tidak akan beri. Kalau kajian menunjukkan perlu booster shot, kita akan beri.
Okay, thank you, Dr. Jim. So to the person who said, who spoke up in favor of regular checkups for their first pregnancy, as Dr. Imelda has already said, it is very important to have your checkups, to be regular in your checkups, especially if it's your first pregnancy. But because of the crowding issue, there is a certain amount of positive factors to opt for private care if it is available to you. It's just on your onus as to how safe you feel in the different hospitals, whether private or at KKM. Would you say that that would be par for course, Dr. Imelda?
Actually, my advice based on your risk factors is not just about the first pregnancy. It also depending on a lot of other things, because if you're concerned about your health, for example, you're 40 or above, and you want to know whether pregnancy is the right thing for you, then you need to have health assessment first. It's not just about an age factor. Do you have diabetes? Do you have high blood pressure? What happened in your previous pregnancy, post-obstetric history, they are also important. So there are many patients out there who are concerned about their health because they've had perhaps problems during their last pregnancy. They've had emergency cesarean section because of preeclampsia, for example. So we are guided by your risk factors. Please come and get an assessment prior to your next pregnancy if you're considered high risk for pregnancy. And it does not matter whether it's your first pregnancy or your third pregnancy.
Yeah. All right. Following up on your quote about C-sections, one of our viewers wants to ask if she's recovering from COVID and pregnant, she's still experiencing shortness of breath. Should she already be opting for a cesarean?
Why I would actually know if you have recovered from COVID, all right, if you have shortness of breath, we will need to investigate why you have shortness of breath and to assess that and to treat that problem. It could be asthma, it could be anemia in pregnancy. It could be cardiac problems. So once you have looked at and you have investigated the cause to shortness of breath, then we'll be able to advise you what is the best mode of delivery. It does not necessarily mean to say you have to have a cesarean section.
All right. So on the heels of that question, another viewer asks if a woman with a history of COVID is at any greater risk medically during her delivery.
Well, actually, I've delivered many women who have recovered from COVID. And once they have recovered from COVID, I treat them just like any other mothers who never had COVID. They can have, they can have a normal birth, and they did have normal birth. And because they're no longer infectious, and they're back to normal health. So as long as you are back to normal health, then you can have a normal birth and you're not necessarily at increased risk of any further problems during labor and delivery when compared to women who never had COVID in their pregnancy.
All right. So another question from a Facebook viewer. I'm someone who is already on IVF treatment. I'm waiting for an embryo transfer. I was scheduled for an embryo transfer in July. My first AstraZeneca dose is on the 1st of July. I'm 35 years old and been married for 6 years.
All right, so we need to look at what is your risk of exposure to COVID. Okay, so if we are now in a pandemic situation that is quite critical at the moment. All right, we are in lockdown at the moment. And if that were to be extended, so in July, if things were to settle down, you have an option of waiting for your second dose of vaccine before pregnancy. Because as far as I'm concerned, if you have your 2 doses of vaccine, you are more protected than if you didn't have your 2 doses of your vaccine. So you got to think about what are your risks in your pregnancy as well, because, you know, age factor also increases the risk of severe COVID disease. If you're above 35 and you're pregnant, if you have other risk factors and you're pregnant, the risk of COVID disease is higher. So looking at your pros and cons, look at your pros and cons. You know, if you can delay getting pregnant for the sake of having 2 doses of AstraZeneca vaccine, all right, then you are more likely to have a much better pregnancy outcome, because you know you're more protected from COVID during your pregnancy and more protected from severe COVID disease during your pregnancy. So this is something you will have to decide with your IVF doctors. I'm sure delaying a little bit just for the sake of having a second vaccine is not a big deal. After all, you have, I'm sure, waited a long time for this IVF.
Oh, that is so sweet. I love the compassion. I love how you're responding to this question on a very emotional as well as a very cerebral level. And I think it makes all the difference for somebody who's trying so hard, you know, with an IVF journey, to hear this from you. Thank you so much, Dr. Imelda. Dr. Jamila, if a woman is planning to have children, although not actively trying, should they be vaccinated first before they embark on something? And is there a safe window pre-conception to which they can be vaccinated?
Yeah, so I think that Imelda has really answered that in many ways earlier. Maknanya, if you're planning to get pregnant, go ahead. You know, if you fall pregnant, then we can time your vaccination. The vaccination itself doesn't affect whether, you know, your fertility, or whether if you fall pregnant, there might be complications. There is no effect. So, you know what, don't overthink it. You're planning to get pregnant, good luck. You know, hopefully you will fall pregnant quickly. And then if you are pregnant, then let's time your vaccine so that you will have it at between 14 to 33 weeks. There is a gentleman, I love that there is a man on this chat who's asking that he was very concerned. His wife is pregnant, and that My Sejahtera asks you for when your due date is, because the people behind My Sejahtera, there are many doctors, so we are calculating behind the scenes when your vaccine is. So it's not that we are not aware that you know, we need to time your vaccination. Jadi bila you bagi tarikh expected yang dijangka bila lahir, kita boleh kira bila agaknya kita boleh memberi vaksin yang sesuai untuk anda.
There seems to be a very great interest in transplacental transmission. Quite a few questions on this one. You know, people being a little bit worried, you know, as to how far vaccines can pass through the placenta. I know, Dr. Imelda, you spoke about this already, you know, as the placenta being a barrier. But maybe for somebody who's just joined, could you just give us a quick summary of that one again?
Okay, so vaccine does not contain any live virus. So we are not worried about giving our pregnant mothers the vaccine. So the vaccine is meant for the mother to stimulate a mother's immunity reaction against SARS-CoV-2 virus, and therefore develop antibodies against that virus. Now, is there antibodies that can transfer to the placenta, but not the vaccine? Because we're not worried about the vaccine, because the vaccine is not a virus. So I think a lot of women are worried. They are worried because perhaps there's confusion between vaccine and the virus itself. Vaccine, so you just have to remember that the vaccine contains no live virus, all right? And it does not matter, because what you want is the antibodies that develop from the vaccine. That's the one that can transfer to the placenta to help protect your baby, and also transfer to your breast milk to help protect your baby after birth. There's some studies about Pfizer vaccine, and they have shown that in women who have been given this vaccine during pregnancy, they found at birth the baby, the blood of the baby contains in a cord blood, in umbilical cord, dalam tali pusat darah baby tu mengandungi antibody yang sama yang ibu buat antibody untuk melawan COVID virus ni. Dan mereka juga jumpa dalam susu ibu ada antibody ini. Jadi sebab itulah saya nak bagi pesanan kepada semua ibu-ibu hamil ni, jangan takut ambil vaksin semasa hamil. Ia tidak akan memberi anda virus itu, dia tidak akan memberi anak anda virus itu.
Dan yang penting juga jangan berhenti menyusukan bayi jika anda diberi vaksin, ya. Ini sangat penting kerana yang disebutkan dari Dr. Imelda, antibody ataupun bahan-bahan yang boleh mencegah daripada mendapat penyakit yang serius akan juga berada di dalam susu.
So there you have it. Ainul, your medical officer and breastfeeding counselor, Dr. Jamila has actually stressed what you've asked us to say. There is no need for a mother who is breastfeeding to stop receiving the vaccine. All right.
We're breastfeeding friendly, folks.
Absolutely, absolutely. All right. A question about congenital COVID-19 that's been recently reported. Is there still risk of transplacental transmission?
I have read some case reports about it. That's very rare, extremely rare, and they usually involve women with severe COVID disease. And none of them are from women who have very mild or asymptomatic disease. What you need to know is that in 100 women who are pregnant who have COVID disease, usually about more than 2/3, about 75% will have asymptomatic disease. But in the 25% who have symptomatic disease, they are more likely to be admitted in ICU, all right? And they are also more likely to be in the third trimester. So if you're in a third trimester, you're more likely to get more severe disease than if you were in the first 2 trimesters in your pregnancy. And we know that babies who are born to mothers of COVID positive, majority of them will not be born with congenital COVID or positive COVID at birth. Majority of them do not have that. So in just a very, very minority, a very small number, usually women who have severe COVID disease at the time of birth, when we find the babies to be positive for COVID.
Have you ever personally had to deliver any COVID babies?
Yes, I do.
Really?
Yeah, because we are in pandemic mode, and anyone around us can have COVID. They may be asymptomatic carriers, anyone around us. That is why we must always protect with masks and social distancing and hand hygiene at all times. Anybody can have COVID around you.
Tapi yang pentingnya Dr. Imelda, frontline workers like you and health professionals like Adiba, the reason why we can safely carry on our work is because we have been vaccinated. Bayangkan kalau doktor-doktor, jururawat dan sebagainya tidak mendapat vaksin dan untuk melindungi diri mereka, mereka tidak boleh bekerja untuk menjaga anda semua. Jadi itulah kepentingannya vaksin itu. Jadi kalau kita semua kena jaga sesama kita, kita kata lindung diri, lindung semua, sebab kita tak nak jadi fokus untuk infection yang merebak kepada orang ramai. Itu sangat penting.
Kalau saya boleh share ya, semenjak the end of phase 1 di mana kami semua frontliners dan healthcare workers telah menerima vaksin di PPUM di mana Dr. Imelda juga bekas profesor di PPUM. Pada tahun lepas, the level of fear di kalangan medical doctors dan nurses was very, very high. Ya. Maklumlah masa tu even our own knowledge about COVID-19 pun tidak setinggi sekarang, macam mana kuman itu merebak dan siapa yang berisiko dan sebagainya. Tetapi setelah the information that we have, the scientific knowledge has improved, dan juga semenjak vaksin ini, the kadar the fear dan irrational behavior saya boleh nampaklah di PPM sendiri sudah turun, dan tidak boleh dinafikan memang masih ada mereka walaupun telah menerima vaksin 1 dos ataupun 2 dos masih boleh dijangkiti, dan baru-baru ni telah diumumkan berapa ramai jururawat dan healthcare professionals masih dijangkiti walaupun telah menerima vaksin. Tetapi yang penting ialah boleh dikatakan semua mereka ini mendapat jenis COVID-19 yang mild, ya, kategori 1 atau 2 sahaja. This is the overall aim of the vaccine, ya, supaya one of the 2 aims of the vaccine. Satu, jika masih juga dijangkiti, tahap jangkitan itu tidak sampai ke tahap yang serius dan boleh membawa maut. Dan 2, of course, untuk to make sure that kadar jangkitan boleh diturun dengan mendadak.
Yeah, that makes perfect sense. You're right, Adiba. It's very, very important that people know that you need to be vaccinated so that you do not suffer the very, very serious form of COVID, something that results in death or in a very protracted, painful, long COVID.
Karen?
Yes, Dr. Jen.
Earlier on, Dr. Imelda was talking about pantang. Kita tahu bahawa di dalam masa pantang tu ada ramai juga yang mengambil yang kita sebutkan confinement lady, ya, maknanya orang yang jaga kita semasa pantang. Dan saya syorkan kalau boleh make sure confinement lady you pun dah vaccinated. Ini satu cara untuk kita membuat promosi vaccination. Maknanya kita boleh demand from the companies yang supply confinement ladies ni bahawa mereka kita hanya ambil ataupun menggajikan orang yang menjaga tu orang yang divaksinasi. Jadi itu dapat melindungi diri kita sendiri dan juga keluarga kerana mereka datang ke rumah dan sebagainya.
Oh, that makes perfect sense, Dr. Jim. It really does, especially among the Chinese community, where the big thing now is no longer the old-fashioned Puyit lady who used to come and live with you, but they have these mass post-pregnancy centers, that you have 5-star hotel services and, carers around the clock who take care of your babies and who give you 7 meals a day and all that kind of stuff. And you're right. I think it's very, very necessary for a person using that service to make sure that every single person in a facility like that, because they're so close to the babies, is vaccinated. That is a completely, it's a point that many mothers would not think about, and I thank you for bringing that up. So another viewer shares that being pregnant in a pandemic is very stressful. She asks our doctors if they have suggestions on how pregnant women and new mothers can handle the stress better. Feedback, ladies?
I think that mainly requires a lot of social support. We want our pregnant mothers to be protected. Number 1, try and get the vaccine. That can reduce your anxiety a lot, knowing that you're protected. Number 2 is to ensure social distancing and mask, because you really don't want to get COVID during this time of your pregnancy. And you need to have that sort of supportive environment around you. And that can help you reduce anxiety when people are more protective of each other. We also want our mothers to know that, the services that, for example, the services that I do for our pregnant women have changed. It's more of assessment of your risk factors. Kalau you adalah seorang ibu hamil yang berisiko rendah, bila anda seorang yang berisiko rendah, tak perlu datang untuk ke klinik terlalu kerap. Itu kami boleh kita utamakan mereka yang ada risiko tinggi. Mereka yang ada risiko tinggi untuk dalam pregnancy, dia akan perlu jumpa doktor kerap, seperti juga masa zaman tak ada pandemik ni. Dan jangan takut datang jumpa doktor sebab perlu. Jadi we have to look at weigh your pros and cons. We don't want you to miss your antenatal care if you need it. At the same time, if you are low risk pregnant women, we can manage you so that you don't have to come to clinic so often, because that also gives a lot of anxiety coming out and being in a potential crowded area. And also come and seek help. If you feel that you are under a lot of stress, anxiety, depression, you got to tell us about it. Seek help, because we are here for you.
Is there a hotline or a center or some kind of body that takes care of women in pregnancy and their mental health and their mental issues?
Well, I think it's more towards the obstetrician to assess our women and to make that referral and to give them that sort of support for our pregnant women. Because if we are aware that perinatal mental health issues is increased during pregnancy, during this time of pandemic, we are aware of that, then we should be looking out for that and making sure that they have the necessary referrals if required.
Okay. On to the post-pregnancy stage now. So a listener says, if a woman and her partner have COVID and they're new parents, how best does the couple care for the new baby? Should the newborn be allowed to room with them if they're quarantining at home?
We want to assess each individual patients. If you are no longer in an infectious stage, then it does not matter, because remember, if you have developed COVID and you are recovering, you are already making antibodies that's passed your baby through the breast milk. And what we don't want is the baby is rooming in with you and not getting breast milk. That's even worse. So if you are rooming in with the baby anyway, then you want to protect your baby. You got to give, because mother's milk is the best. And you got to look at, if you are in an infectious stage, usually in Malaysia, we won't allow you home yet. And when you're allowed home with your baby, usually you are no longer in that infectious stage, and we would recommend and we would really promote breastfeeding.
All right. So Dr. Jamila, some insight on this question. Are there protocols in place that by law tells a COVID positive couple what they can or cannot do after their child is born?
I'm not familiar about that.
Repeat that again, Karen, sorry.
Is there an SOP, a specific SOP or a protocol that by law tells a COVID positive couple what they can or should not do after birth? Like, they should confine themselves 1 month to, to home quarantine just to take care of baby as well as the new mother. Is there anything, that they have to tag their Maisajatra as being, new COVID positive parents?
No.
Nothing?
You can't stigmatize people who have had COVID-19, right? They get an infection, they get over the infection, and then, they are normal, just like everybody else, except they have more antibodies than anyone who's not been infected or has not had a vaccine. So I think that, number one, I really want to stress the stigmatization issue, sebab kadang-kadang orang rasa macam dapat COVID ni malu, tak nak beritahu. Sebab tu kita ada masalah kan nak buat contact tracing, sebab dia orang tak nak beritahu yang siapa dia jumpa dan sebagainya. Jangan segan, jangan malu. Yalah, kalau you kena pun itu satu, dah jadi penyakit, make sure jangan bagi kat orang lain. So that's important. So I think the short answer is no, there is no law, but the general rule is that, when you are infected, you have a certain quarantine period, after which you are, like anyone else.
Okay, good, thank you. So all the questions we received the last session of Honorary 2 about breastfeeding and vaccinations, the one big question was, should breastfeeding women take the vaccine?
Yes.
Definitely.
Yeah, okay. And if so, is one better than another? Is Pfizer still the go-to vaccine for a lactating woman?
Well,
I'm going to say that the best vaccine is
Best
the one you
vaccine
can
is
get
the vaccine
first.
that's in your arm.
yes.
Yes.
Yeah, the best vaccine is the vaccine that's in
Yes,
your
we can sing this in unison now, right?
Yes,
That's the
definitely.
first one you get into your arm.
All right. And can a woman state her position and her choice of vaccine if she is a new mother and lactating and breastfeeding, Dr. Jamila?
Well, if she is offered a vaccine, as I mentioned earlier, our vaccine portfolio, we have 70% Pfizer and 10% AstraZeneca. And then that makes 20% Sinovac. And then we have CanSino and others. But generally, you know, we have more Pfizer than anything else. So chances are, kalau you are breastfeeding or you are pregnant, for sure, you will be given Pfizer if you're pregnant. But if you're breastfeeding and you didn't opt in for AstraZeneca, you will get Pfizer.
Okay.
Because AstraZeneca at the moment is an opt-in. So yeah, so I know what it just came to my mind now, Imelda, and I'm sure you will support me on this. That maybe what we should do is also have vaccines available in hospitals where anyone postpartum is just given a shot if they've never been immunized before. You agree?
Yeah, definitely. You know, not all hospitals are vaccine centers, I believe.
That's right.
And if only I had that opportunity to do that, yeah, every single one of my mothers who delivered, the one who delivered this morning, I would be giving her that vaccine as well.
Absolutely. Dan buat masa ni kajian kita adalah mengenai Pfizer dan AstraZeneca. Jadi kita menanti sama ada vaksin lain seperti Sinovac juga selamat di dalam kehamilan dan juga semasa menyusu. Theoretically speaking, it should be safe because none of them have live vaccines, right? But at the moment, we don't have enough evidence on Sinovac compared to Pfizer and AstraZeneca.
So
I think if you have an option, I always tell my patients, you got to weigh the pros and cons. Kita kena buat pertimbangan. Apa yang lebih teruk? Dapat COVID ke side effect vaksin? Jadi kita jangan buat perbandingan antara apakah side effect vaksin dan tak dapat vaksin. Kena buat perbandingan di antara side effect vaksin dan COVID disease. Jadi kalau kita ada exposure yang tinggi, pendedahan kepada SARS-CoV-2 virus sebab ia di dalam komuniti kita, kalau kita ada risiko tinggi untuk mendapat penyakit COVID yang teruk sebab kita ada masalah dari segi penyakit asma, kalau kita ada masalah pernafasan, kalau kita ada diabetes, tekanan darah tinggi, obesiti dan usia kita. Jadi kita kena tengok pertimbangannya, apakah risiko kalau kita kena COVID untuk mendapat penyakit COVID yang teruk berbanding kepada apakah kesan sampingan vaksin yang hanya kecil. Jadi bila kita buat perbandingan yang itu, the most important thing ialah mencegah.
Absolutely. So if a woman is breastfeeding and she finds herself diagnosed with COVID, should she stop breastfeeding? Can the virus pass through breast milk?
No, I think you should not. See, the thing is depending on once you are already diagnosed with COVID, the likelihood is that the people around you have been exposed. And breastfeeding, we know, is one source of protection for your baby. And I believe that mothers who are positive COVID should continue breastfeeding, even if it means you pump the milk out and somebody else gives the baby the milk. And that's one option to reduce transmission from mother to baby. Then mother, we will advise to use mask, even indoors. And when you're not breastfeeding, to have exercise social distancing with the baby. All right, take the baby to another room. Or, you can pump your milk and somebody else give the milk to the baby. Those are options to reduce the risk of transmission to the baby. It's not going to be transmitted via breast milk, but through air that we breathe and the droplets to the baby. We don't want babies to wear masks, but mothers can wear masks.
Absolutely not. All right. I get you. So if a woman has COVID and she delivers a baby in hospital, will both baby and her be under an extended quarantine period?
Sorry, repeat the question.
If a woman has COVID and delivers a baby in hospital, is she under a longer quarantine than the normal, postpartum care?
No, the quarantine, the numbers of days of quarantine will be the same.
Okay.
And also depending on whether she is still infectious at that time, because some women may have had COVID positive a few days before delivery. Mm-hmm. And by the time they have delivered, she may no longer be in an infectious state and do not need to be in hospital that long. If you have just got COVID infected, then you need to be quarantined for a bit longer.
Okay, gotcha. Professor Adiba, is a COVID positive woman at greater chance of getting other infectious diseases? And if so, why is that?
So I think there's no reason why someone who's been infected with COVID-19 will be at higher risk of getting other infectious diseases. Yes, maybe transiently your overall immunity will be lowered, but I don't see a reason why they should be at more risk of getting dengue or whatever. I don't think there's data to suggest that.
Okay.
Like we've said many times before, the complications that you see with COVID-19 is in fact as a result of overreaction of the immune system that leads to the changes that we see in the lungs, the clotting that we see, and all those things are an overreaction of the immune response rather than underreaction of the immune response in that 20% or so of people who progress to categories 3, 4, and 5, or 4 and 5 especially.
In fact, Karen, if you look at the data, in the pandemic, the other infectious diseases incidents have fallen. You've seen less dengue and less of the other infectious diseases, probably because number one, we're not going out as much. Yeah. We are taking better health precautions, better hygiene and so forth, right? So I think this is something that we have seen.
That's very true. But globally, what it has done in terms of what the impact of COVID-19 on other major infections like HIV, TB, and malaria is, apart from shifting the focus on these other major killers, infectious disease killers, it's also going to shift the financial resources and human resources, because we're all very busy, responding to COVID-19 and having less time to focus on HIV, TB, malaria, for instance. And global studies have shown that the advances that we've made in combating HIV, TB, malaria, for example, have been quite significantly impacted negatively by COVID-19. So, the need to bring this pandemic under control, there's many reasons, but the other is also we need to catch up with all these other things that we've been working so hard on for the last several decades and been making considerable progress in things like malaria, TB, and of course HIV.
Yeah. Karen, I see a repeated set of questions in the chat. people who ask, they took their first dose of the AZ vaccine when they are pregnant. Do they need to wait till after the pregnancy to take the second dose? So I think just to be clear, when you're pregnant, you take the vaccine between 14 to 33 weeks. And if that happens to be suitable for your gestation, then go ahead. If, for example, you took the first dose at 32 weeks, then you can wait till after delivery to take your second dose. So for AstraZeneca, you can take the vaccine anything between 4 weeks to 16 weeks. But ideally, you take it between 4 to 12. The reason why in Malaysia kita pilih 12 minggu adalah kerana the immunity, or rather the protection, is maximal on the 12th week. So that's why we choose 12 weeks. But for example, if you happen to be, say, 28 weeks pregnant and you took your first dose and you are high risk, then you can always ask for your second dose to be brought a bit earlier, for 4 weeks, for example, so that you complete your 2 doses before you have your baby. So it's very much also a case-to-case basis, depending on your risk of exposure dan sebagainya.
Okay. There's one, Karen, there's one recurring question that kept coming to my Facebook page from followers. They asked me questions about, are they allowed to take AstraZeneca vaccine if they're using contraception? Have you heard of that question? Because many people seem to think that they cannot have the vaccine when they are on contraception because of this fear of blood clots.
Correct.
Yeah. So I just want to let you know that all types of contraception, there's only one type that increase your risk of blood clot, not all of them. So kalau you ambil kaedah merancang yang mencucuk tu, tak ada risiko meningkatkan darah beku. Kalau kaedah intrauterine contraceptive device macam IUCD atau alat dalam rahim, tak ada meningkatkan risiko darah beku. Kalau anda pakai implan, susuk implan, tak ada risiko yang meningkatkan darah beku. Kalau kita tengok dari kaedah pil pula, pil merancang ada 2 jenis. Jenis yang hanya progesteron, iaitu satu jenis hormon tu, dia tidak meningkatkan risiko darah beku. Yang meningkatkan risiko darah beku ialah combined oral contraceptive pill, iaitu yang ada 2 jenis hormon, estrogen dan progesteron. Walaupun dia meningkatkan sedikit risiko darah beku, kami sebagai doktor tidak bimbang anda ambil vaksin AstraZeneca. Sebabnya ialah mereka yang perlukan contraception ialah orang muda-muda. Okay, jadi just to let you know that the risk of darah beku meningkat disebabkan usia penuaan, dan kebanyakan wanita yang mengambil contraception ialah wanita muda. Jadi I can tell you, I have that privilege to say that you're all young women, because I've just turned 50 and I've just reached menopause, and therefore everybody who are using contraception are younger than me. You're all young women. Your risk of having blood clots are pretty low. So if we look at the whole population, the risk of having blood clots is about 1 in 1,000 population in a year. All right, that is about 10 in 10,000 people in a year. But for women of reproductive age, that risk is very low. That's about 4 in 10,000 women who are getting blood clots, even without using contraception. All right, this is what we call the background risk. But when you take the oral contraceptive pill yang ada estrogen dan progesteron ni, and combined pill ni, risiko dia meningkat sedikit saja. Daripada 4 dalam 10,000 orang, dia meningkat ke 6 atau 7 dalam 10,000 orang. Tapi kalau anda ada obesity, risiko itu meningkat ke 10 dalam 10,000 orang, walaupun tak ambil pil tu. Jadi kami sebagai doktor selalu membuat penilaian kesihatan kepada wanita, apakah contraception yang sesuai untuk anda. Jika anda merokok, dan anda berusia 35 tahun ke atas, risiko untuk mendapat darah beku sangat tinggi, 20 dalam 10,000 orang. Jadi mereka tidak akan diberikan oral contraceptive combined pill. Jika anda ada risiko tinggi untuk mendapat penyakit jantung seperti mereka yang ada obesiti, mereka yang ada diabetes, tekanan darah tinggi, kami juga akan membantu anda memilih kaedah merancang keluarga yang lebih selamat seperti kaedah cucuk, kaedah suntikan implan, susu implan, kaedah intrauterine device, okey, ataupun pil progestogen only pill, bukan pil combine. Jadi kami akan memberi anda nasihat bergantung kepada risiko anda mendapat darah beku. Jadi kebanyakan orang yang mendapat nasihat doktor tak pergi beli contraception dia sendiri ya. Mesti ambil nasihat doktor sebelum ambil preskripsi combine oral contraception pill. Mereka adalah orang-orang muda yang berisiko rendah untuk mendapat blood clot. Jangan lupa kalau anda hentikan kaedah merancang dan anda terhamil, risiko blood clot lebih tinggi lagi. Okey, risiko blood clot sama seperti anda merokok, dalam lebih kurang 20 in 10,000. So you got to think of pros and cons. Kalau anda menggunakan kaedah merancang keluarga, apa-apa pun boleh ambil vaksin AstraZeneca tapi kalau anda takut dan anda hentikan kaedah merancang keluarga dan anda terhamil, risiko untuk mendapat darah beku blood clot sangat lebih tinggi bila anda hamil.
Wow, that was awesome, Dr. Imelda. Seriously, I've never heard it said in Masa Malaysia as effectively before, you know, and I'm going to extract that and put that on my personal Facebook. That means so much to hear.
Statistics made easy.
But also, I mean, I can get now why you're so subscribed on social media. I can get why so many of your followers think that you're pretty much, you know, the cat's meow when it comes to all things obs and guys. So yeah. Have there been any other recurring questions that you get on your Facebook when it comes to COVID, pregnancy, and contraception?
Well, I think this is mainly it. You know, they need to know that different types of contraception give different effectiveness, and it's not about which is the best contraception. It is about what is good for you. So ramai orang tanya soalan dalam media sosial, dia tanya, doktor, contraception mana yang paling baik sekali? Saya jawab, apa yang terbaik untuk saya tak sama dengan apa yang terbaik untuk anda. So you kena jumpa doktor dan bincang tentang masalah kesihatan, jenis kaedah merancang yang sesuai untuk anda, because you know the acceptance of different methods is different to different people. The side effects of different methods is different to different people. In the end, kita cari kaedah yang paling sesuai untuk individu itu.
That makes a lot of sense. Thank you. Dr. Jamila, I'm sorry. I know this is very much a pregnancy and COVID session, but as usual, people won't let you go because you're the face of the vaccine rollout for a lot of people. And there are questions. Are you okay to take a couple of vaccination questions?
Sure.
All right. So to the listener who said, I registered for Astra before, because the suggestion to wait was not out back then, but I cancelled on Astra and can't update my MySejahtera feature to indicate that I'm pregnant. What do I do?
Okay, there have been a few technical issues with MySejahtera lately. And now, let me first of all make a caveat. I'm not in charge of MySejahtera. I'm probably one of the least tech-savvy people I know. So the first thing you do, my advice, is uninstall and reinstall your MySejahtera. You won't lose any data as long as you use the same IC, same mobile number, you know, the same password and so forth. So that's number one. Many people, when I tell them to do that, everything works fine. The second thing, if it's still a problem, you can contact go to the website of my vaccine covid.gov.my, and there is a helpline there. Now the helpline has been boosted, so you should get better response now compared to before. And please try those two first. If it still doesn't work, contact Sense with Science. We'll try and figure it out for you and help you out. I don't do this as a personal, I'll be inundated. But, if, for example, someone is pregnant, and it's very important that we catch them at the right gestation, we will bend a little bit to help you out.
Ooh, you've just walked into that, Dr. Jim.
I know. My Sarah, forgive me.
There's just a question that says, is there any forum for pregnant women to get the jab ASAP other than waiting for appointment from MySejahtera? And you've just volunteered yourself.
Well, what I believe it or not, this is how what work I get onto myself, because I'm very passionate about this, obviously, because I am by training an obstetrician and gynecologist. So, I'm working closely with the MySejahtera team to make sure that we don't miss out, all these appointments as much as we can. We have about 500,000 pregnancies a year in Malaysia. So you're talking average about 20 over 1,000 to 40,000 a month, right? That we need to look at and double that, because you need 2 doses. So, but we're trying our best to make sure that we don't miss out. Now, for those who are in the early part of pregnancy, you still have a bit of time. But for those of you who are kind of hitting, 20 weeks, 25 weeks, alert us. We will do our best, because we do want to make sure that pregnant women are protected.
Oh, that's wonderful. Dr. Jim, I come back to the question about how Dr. Imelda was saying it would be so good to have been able to have vaccines on hand so that she could readily inoculate women who are in her care. Is there any way or any move which is going to be made to letting specialists do this?
Well, part of the problem, Karen, is that, women deliver in many different settings, not just in private hospitals or specialist clinics. They also, mama yang bersalin di hospital kerajaan dan sebagainya. Jadi, come July, bila kita dapat, we will have about 10 million doses by July and August, which is great. Then I think that we will push out to many of the larger hospitals to keep some stock. Jadi kalau walaupun tidak mungkin berada di setiap hospital, tetapi kalau boleh kita simpan di the major general hospitals, for example, kan, that at least women have a chance to do that. So I'm looking into this right now to see how we can place and hospitals like private hospitals yang besar di mana quite a significant number of deliveries. Also, we can do that. Also in the chain of hospitals. For example, Imelda, you're in the KPJ chain, so KPJ can have one hospital designated to receive vaccine. So we have to figure this out. The teaching hospitals are very important because they're quite centrally located. But we have to find a way, because 40,000 a month is not a lot. If you have 10 million stock, then we have 40,000 a lot is not a lot. So you can be assured I'm personally keeping an eye on this, because it's close to my heart, right?
Yes.
I can't think of a better person to be in charge of this. Thank you, Dr. Jamila. You give us faith, it makes it much easier to have to know that somebody like you is behind this and driving this. A final question from one of our viewers, and they want to know, Dr. Imelda, with the time that you spend being a practicing obs and guy, how do you speak to your followers on Facebook? Do you have a social media manager, or do you do this on the fly?
I think, to be honest with you, I am not a social media person. I am very lousy with social media. What I do is whatever's on my mind, I'll go onto my social media and I type it out, and then I go back to work. I don't hang around in social media. If you notice in Twitter, Facebook, and Instagram, I don't follow anybody. I have zero following. I don't follow anyone. I don't read notifications, and I hardly go there to scroll anything. My talent is writing, in layperson's term, in a language they can understand, and I can write very quickly. So you can say that, you know, I'm a talented writer and get my point across because I can do that very quickly. What's on my mind goes into social media very quickly in my Facebook, and then I come out of it and I see all my patients. And then some of my patients will ask me recurring questions, and that will be on my mind. So many people asking the same questions over and over again. Then I'll go into social media. That's your patient information leaflet for you. Type it all down for my advice so that all my patients, when they come to see me in clinic, when I ask them, do you have any more questions? They say, so it's all right, Dr. Imelda, I read it on your Facebook.
Oh, I think it helps, you know, when you have that. But then there's also a segment of the public which does not read social media, which isn't engaged on social media, and so who need to speak to you face to face when they want questions answered. And I think also that re-emphasizes your calling as a doctor, right? That face-to-face communication, the ability to communicate and speak one-on-one with your patients. I think that's a very, very special thing.
Perhaps that's part of my training in fetal medicine. It's slightly different. Fetal medicine involves congenital malformations of their unborn baby and trying to counsel people about what will happen after birth, what will their babies be like, and their emotions, bereavement after stillborn baby, stillbirth, and women losing babies and miscarriage. You learn how to spend more time communicating with patients. And I use that, what I have learned over the years, and pour it out in social media in the language that people can understand. We need more love in this world. We need more compassion in this world. We certainly need more empathy in this world. And by always, you know, having that compassion when you write in social media to others, it does, I know where I believe it encourages others to have compassion as well.
And it comes true, and I couldn't be happier at the choice of guests today. You've really touched us, and I think you've made a great impression on our viewers. Just like that, it's nearly time to wrap up. So thank you, Dr. Imelda, for being with us today. Do you have any final thoughts, anything that we didn't cover that you want to say?
I'm so happy to be here with, you know, my Prof. Adiba, Tan Sri Jamila, and Karen. You've made my day because, you know, this is a it's a golden opportunity for me to actually have this with you. This is wonderful. Thank you for this opportunity.
We were very pleased to have you with us. Professor Adiba, a wrap up of the session. And, you know, I love the fact that you're in the background and you're running like a prime program. You know, you're listening and you're digesting. What are your takeaways and your final wrap ups for this session today?
Thanks, Karen. I think everything that needed to be said about women, COVID, and pregnancy and vaccination has been said by these two experts. I don't think there's anything more that I can add. But what I want to say is, in addition to compassion and empathy, I think, and love, kindness is what we need at this point in time in our COVID pandemic response. More love, compassion, empathy, and kindness, and less of the stick, I think, will help us move forward better than we are at the moment.
Yes, and no public spray down and disinfection, right?
We won't go there, please.
Dr. Jim, we've successfully gone through our first week of MCO 3.0. You have always been such a proponent of being good, duduk diam-diam, stay in the house. But you've also said it in very, very many ways, and sometimes in a variety of tonal patterns and voices. What's been your first week of lockdown like for you, and has there been any new learnings in this 3.0? Oh, Dr. Jim, your mic.
The first thing I would say is we can't go on with lockdowns like this, right? This is not the natural way to live. But unfortunately, kalau kita nak tamatkan pandemik ini, jawapannya dan rawatannya di dalam tangan kita sendiri. Kita yang pembawa virus. Ya. Dan kita tahu sekarang banyak lagi ilmu yang menyatakan virus itu juga berada di udara. Dia boleh, it's airborne now. Yeah? So we are learning many new things every day. So harapan kita ialah vaksinasi. Ini satu daripada harapan yang paling penting untuk kita dah lihat di negara barat, bila rakyat mereka mendapat vaksinasi, bilangan kes turun dengan mendadak. This time last year we were watching other parts of the world suffer with so many cases, and we were only in the hundreds.
Yes.
And now other parts of the world are very low and we are in the thousands. And so I think there's some big learning for us there that, even when given an opportunity to restart the economy, we did not play our role well to really protect each other by, really not going out in groups and practicing the standard operating procedures. So now the last hope I feel is vaccination. So this MCO, let's use it for us to, number one, make sure that we get our vaccines out as quickly as possible. I'm in Penang right now, Karen. Tomorrow morning, we will be launching a new mega vaccine center in Spice Arena. So I will be there with all the frontliners very early in the morning. And similarly, we roll out in Johor, in Persada tomorrow morning. We roll out in KLCC Convention Center. And on Tuesday, I will be at Pusat Perumahan Rakyat, where we are going to pilot a mobile truck to vaccinate people in Pusat Perumahan Rakyat, because they live in very crowded conditions. So we have to get that vaccine into people's arms in one way or another. So I'm appealing to our listeners, pendengar-pendengar Sense with Science, tolonglah, bantulah kita semua, kerana frontliners kita semua dah lelah dan penat, dan juga hospital kita dah terlalu sesak. Dan kos pandemik ini, kos untuk kita menjalani PKP ini sangat tinggi. Untuk orang macam kita ni mungkin kita ada gaji tiap-tiap bulan, tapi mereka yang lebih susah dari kita, yang terpaksa bekerja untuk mendapat makanan untuk letak di hadapan anak-anak dan keluarga, MCO atau PKP ini adalah sangat perit. Jadi kita minta inilah last PKP untuk kita. Jadi tolong dapat vaksinasi. Wanita-wanita yang hamil, jangan ragu-ragu lagi, jangan takut. Dr. Imelda dan saya harap telah pun memberi maklumat dan maklumat sains dari segi berapa pentingnya untuk kita mendapat vaksin ini dan berapa selamat untuk kita mendapat vaksin ini, sama ada kita hamil ataupun menyusukan bayi. Jadi jangan tunggu, jangan lengah. Kalau ada masalah teknikal, tolong hubungi hotline ataupun MySejahtera dan ataupun Facebook Sense with Science. Drop us a line. We will try. Don't use this as the first line, please, because we can't cope. Tapi cuba, kita memang sangat prihatin tentang khususnya bagaimana kita ingin memberi wanita yang hamil dan menyusu bayi peluang untuk mendapat vaksin di dalam jangka masa yang agak pendek untuk mereka mendapat vaksin itu. Jadi kalau saudara mara kita, kalau kita dah dapat vaksin, kita mesti influence orang yang keliling kita sekarang. Kalau kita kalau setiap rakyat yang telah mendapat vaksin membawa 10 orang untuk dapat vaksin, jadi kita akan dapat mencapai immunity berkelompok.
Yes, well said as usual. Thank you, Dr. Jim. So this has been Sense with Science, brought to you by Pusat Perubatan Naluri and supported by Astro Awani. Thank you so much, our viewers, for being part of a scintillating conversation. Our session will be made available on Facebook, so make sure you click the like button and subscribe to us for access to all our previous content. We've reached over 700 overviewers today, one of our best view accounts. We thank you for that, and we know it is largely in part today to Dr. Imelda, and we thank you for that too, for making time and rushing back after our delivery to be with us today. We've made it through week 1 of MCO 3.0 Malaysia. I'm Karen Michaela Tan, asking you to be kind to yourself and others. See you all next week, and thank you for being here with us. Goodbye.